Dental ethics. Dentistry is a profession different from general businesses. As a professional dental assistant, you are bound by an ethical code of conduct. Ethics deals with moral conduct and wrong behavior and good and evil. Ethics includes values, high standards of conduct, and professional and personal obligations in interacting with other people. These qualities are important to us as a dental healthcare professionals as we provide dental care to our patients. Ethics seeks to answer two basic questions. What should I do and why should I do it? Ethics refers to what you should do, not what you must do. The law deals with what you must do. You have been learning personal ethics throughout your life in a variety of ways from the following sources: basic instinct, your parents, teachers, religion, observation of other people's behavior. Regard for self-determination, which is autonomy. A regard for self-determination includes the right to privacy, freedom of choice, and the acceptance of responsibility for one's own actions. To do no harm is non-maleficence. Promotion of well-being is beneficence. The basic principles of ethics are regard for justice, veracity, confidentiality, privacy, and continuing education. Confidentiality is a very important issue in the health profession. Healthcare professionals have an obligation to respect the patient's privacy. Hence why we have those HIPAA forms that the patients have to sign and we keep in their records. However, conflicts involving the principle of confidentiality, such as in reporting suspected child or elder abuse, will arise. And if you work in the pediatric branch of dentistry, you will see sometimes things that you think you might have to report, like when it comes to child neglect, child abuse. So this is when it comes in. Do I breach that confidentiality between patient and assistant? Am I doing the right thing by trying to help this child if indeed they are in trouble? And you also see that with elderly people. Sometimes the patient's right to confidentiality must be balanced against the rights of other individuals. Continuing education, which are also known as CEs, ethical obligation of dental assistants to maintain and update their knowledge and skills. Continuing education is an important and stimulating part of the dental assistant life. CE courses are readily available at professional association meetings and through home study courses. And these you will do throughout your career, especially if you are a certified dental assistant. If you passed your exam, you need to have certain continuing education credits, and you need to have proof of those in order to maintain your certification. Professional code of ethics. All the major professions, for example, dental, medical, legal, have written codes of ethics. These are voluntary standards of behavior, not laws, and serve as a method of self-policing within a profession. The codes of ethics of most professions have been revised to keep them consistent with the times, but there has never been a change in the moral intent or overall idealism. Reasons for code of ethics: to demonstrate the standard of care that the public can expect from their members, to enhance the ethical consciousness and ethical responsibility of their members, to guide members in making informed ethical decisions, to establish a standard for professional judgment and conduct. The American Dental Assistants Association Principles of Ethics: cause no harm, uphold all federal, state, and local laws and regulations, be truthful and honest, recognize and report signs of abuse, assist in informed decision-making, do not discriminate against others, support, promote, and participate in access to care efforts, be compassionate. Examples of unethical behavior: charging the patient for a full set of x-rays when only 6 films were taken, the principle of justice; pressuring a classmate into a decision, principle of autonomy; Refusing to help a classmate learn is the principle of well-being. Harming another person by repeating gossip about him or her is the principle of doing no harm. The difference between ethics and law. Legal issues are settled with the use of laws and court decisions. Ethical issues are subject to individual interpretation with regard to the right or wrong of a particular situation. So ethical is basically a moral decision, a moral behavior, depending on your belief. It's not something that has to be done through court or any legal issues, but it's whether asking yourself, is this right or is this wrong, and should I do something about it? Steps for solving ethical dilemmas. Step 1, identify the alternatives. Step 2, determine all implications. Step 3, rank the alternatives. Step 4, choose a course of action. Legal and ethical implications of ethical dilemmas. You may be faced with a situation in which your dentist's employer's conduct violates ethical standards. Before you make any judgments, be absolutely certain of all the information and circumstances. If violations of ethical conduct have been committed, you must make some decisions. Do you wish to remain under these circumstances? Should you seek other employment? If you remain, will it affect you in the eyes of future employers? These decisions are difficult, especially if you like your employer and enjoy your job. A dental assistant is not legally obligated to report questionable actions on the part of the dentist or to try to alter the circumstances. So you're not legally obligated, but are you ethically obligated? However, an ethical dental assistant will not wish to participate in a substandard care or unlawful practices that may be harmful to patients.